Now, over the last 2 months, we've seen coronavirus cases climb. Along with it, hospitalizations and deaths. Channel 3 Eyewitness News reporter Matthew Campbell is joining us now. And Matthew, I know you're looking at an important comparison tonight.
Erin, yes, the state is likely in the middle of the second wave, and that was expected. That means that all the metrics are once again on the rise, but today the governor put it into perspective. Tonight we have 232 people in the hospital. That is not testing the hospital capacity anywhere in the state. And when looking back at what the state went through during the first wave in March and April, we're in a good spot. The governor says back then, a third of patients hospitalized ended up in the ICU. Today, about 20% go into the ICU. Also in March and April, 22% of the people who had to go into the ICU died. Now it's around 6%. The governor says the reason we're faring much better during the second wave is because treatments have advanced and hospital space is available. So we asked the governor's team, at what point might we need to be concerned that the hospitals could fill back up?
A quarter of hospital beds in total are unutilized right now. And that's, as the governor said, without any actions being taken by the hospitals to free up beds from elective procedures or anything. And only about half of the ICU beds are occupied. So, although the trends on hospitalizations have been increasing, and we are watching that very carefully, as a percentage of our total hospital capacity, the number of COVID hospitalizations we have is still very low.
Now, another thing we learned today is that the median age of death is 80. So this shows the elderly are still one of the biggest, if not the biggest, at-risk group. That is the latest. Live here at the Digital Desk tonight. Matthew Campbell, Channel 3 News.